I'm Veerle Bergink. I'm director of the Women's Mental Health Center at the Icahn School of Medicine at Mount Sinai, and I am a professor in psychiatry. Yes, I think the most important thing is, of course, to be well informed, which and not be ashamed that you do not know this immediately. I mean, I think I'm a reproductive psychiatry, and I wrote a lot about it, and I know a lot about it, but still, for many individual patients, I still search for the latest research out there for this particular compound to make absolutely sure that we're up to date, because things are changing. So I think, and again, we often have time. So I think healthcare providers, it helps if they just look this up together with their patient, and then get back to it, and then sit together like, okay, what are we going to do? Which medications are we going to continue? What are we going to stop? And again, in an ideal world, that happens before pregnancy. if someone, is thinking about having a child. We also know that in the real world, many pregnancies are unplanned. And then I think it's still very important to not panic. As I said before, there are exceptions, such as valproate. I mean, women should not be on valproate in the first trimester, so that should be stopped. But all other things, it's best to pause a bit and just make a plan and not panic and stop immediately, but think about it and look it up. Or, of course, refer, if that is possible, to a reproductive psychiatrist. But we also know that that is not always easy or not available everywhere in the country. So I think it's best to look it up, schedule maybe a new appointment, and sit together and make a plan, and also reassure that that's also an important part, important psychological part, that if you, for example, a woman choose to discontinue her medication, to reassure that she will be fine, that you will be there, that, if possible, other strategies, so that you won't feel guilty for doing that. And the other way around, if a woman chooses to continue her medication, you should reassure her that that is the best way to do right now. And we see too many women who struggle, who feel guilty whatever they do. And we also know that when children get born, there is always a percentages of children who have something that is just bad luck, or later in life children will have like ADHD or autism. And I think it's very important that women do not feel guilty for the choices they made during pregnancy, because most of these cases are really unrelated to the medication they're using. I think it's important to know that women with bipolar disorder or a history of postpartum psychosis are at extremely high risk to get seriously sick after delivery, and that we should do everything to prevent it. And I think we should really think about lithium, both for prevention, but also for treatment of postpartum psychosis, because that is a medication that is not used enough in psychiatry in recent years.